Form Z. Cosmetic surgical procedure application, La Brea Tar Pits Clinic, Los Angeles, California, 90038. Congratulations, prospective client. If you're an actor like so many who come through our door, you've now made it through a sheaf of personal data sheets, insurance forms, and liability waivers that weigh nearly as much as the first script, The New You, will be offered in a few short months. Actually, those months may not be short. They might be the most interminable crucible of pain you'll ever know. This final form is the result of ongoing negotiations with the Medical Board of California. As part of their agreement, wink wink, to sanction surgical procedures that are possibly under-researched, we've agreed to this form's insertion in your pre-surgery packet. The text is provided by the MBC, Medical Board of California, with no editorial input from us. Would that it were NBC instead. Ha ha. Far be it from us at the La Brea Clinic to say anything that might dissuade you from your journey. The fact that 87% of all cosmetic surgery patients report satisfaction with the results tells you how you will feel when we peel those bandages away. Well, actually, not at that moment. That particular moment may be one of the most gruesome of your life, one that will feed unsettled dreams for decades to come. We might be remiss, however, if we didn't point out that 87% may be one of the most erroneous statistics ever printed. Self-reported studies are the most unreliable. Might not cosmetic surgery patients, having invested an enormous amount of money and self-worth into a surgical gamble and subsequently become a subject of intense scrutiny and judgment by everyone who knows them, have cause to claim that everything's great when perhaps the truth is far less simple? But it is not our goal to dissuade you from going under our sterile knives. Not that we couldn't make a compelling case. We might mention the potentially fatal blood clots, potentially fatal reactions to being anesthetized, organ failure, internal bleeding, hernias, and potentially fatal infections. We could talk about those, but we won't. We're focused on the bigger picture, the one that says that someday, a century from now at most, surgical procedures will be so advanced that those concerns will be but a quaint memory. In that vein, vein, get it? We could also talk about the physical side effects you may soon experience, inflammation and bruising for weeks or months, headaches, nausea, scarring that may or may not be prominent and permanent, necrosis, dead, oxygen-depleted skin tissue, and seromas. Don't ask. But we like to think of those possibilities as just fodder for sentimental anecdotes you'll be telling decades from now to youngsters for whom physical perfection achieved painlessly is as taken for granted as sliced bread, gluten-free. Now, to be sure, we could also talk about the psychological side effects you might experience after your scars have faded, or not. Depression, social isolation, family problems, or self-destructive behavior. The feeling that everyone is looking at you cannot strictly be called a side effect, because everyone you know actually will be looking at you, or trying not to, which amounts to the same thing. We don't recommend you dwell on these possibilities because we can't speak with any certainty about them. There are almost no longitudinal studies available on the psychological effects of cosmetic surgery, and the few that do exist are contradictory. Studies are currently being made, which will no doubt be of great benefit in a decade or two. Whether it was irresponsible of the medical profession to perform millions upon millions of medically unnecessary surgeries over the past half-century without understanding the ramifications, that's a question we suggest you address to the Medical Board of California, MBC. They do wonderful work. And please don't be concerned that we haven't perfected our techniques. Admittedly, our most famous survivors, clientele, resemble, well, airbrushed potato heads. But there are no reliable studies available to indicate that airbrushed potato heads are dislikable or unsexy. No, we don't think all those considerations should concern you, because we work diligently toward that glorious day when cosmetic surgery will be available to every man, woman, and child with no physical risks or recuperative period whatsoever. Bodies and body parts will one day be as replaceable and subject to fashion as bestsellers and bathing costumes. The fact that you are sitting in our lobby shows that you get this. Anyone in your life who doesn't merely displays their ignorance of the unstoppable spirit of this great land of ours. No, all those concerns are as nothing and will soon be washed away by the tides of time. The only concerns which are not so skin-deep, rimshot, are these. By any reasonable measure, we live in the most ageist society the human race has ever known. We are certainly the most media-driven, and in our magazines and moving images, old people are marginalized or outright invisible. If we do not learn to once again see nobility and beauty in the natural aging process of every human being, might not our nation's legacy be the greatest act of collective self-loathing in the history of the world? The average price of cosmetic surgery is $7,000. On the day of your surgery, 16,000 children will starve to death. Were you to face even one, then discover that your $7,000 could feed her or him, not for a day, but for 36,842 days, could you resume your steps toward this clinic? Would that make you one of the most callously self-absorbed creatures ever to walk the planet? In a different place or time, might your behavior be treated as a crime against humanity? One final question. On the day of your surgery, who will win? We feel entirely comfortable in saying that you will win, as long as you're comfortable with a win that extends no further than the tip of your nose. If convincing essentially shallow people, and who among us isn't, that you are more likable than you were before, without improving your mind or your manners, can be called a victory, then you will soon be able to proudly take your place in the winner's circle. But on your surgical day, there will be two other far, far greater winners. These winners will dance on your head, claiming you as their new apostle in the war for humanity's soul. These winners, insecurity and vanity. On that day you will stand and be counted, declaring for all time the world you would leave for your children. Sign below to indicate that you have read and understood this form.